Good morning, everyone. My name is Donna Alexina Rallos. I am from BSN 2-1, and today we will be talking about the comprehensive review of omeprazole. So, for the drug's pharmacological properties, omeprazole is a proton pump inhibitor that reduces stomach acid production by inhibiting the activity of the ATPase enzyme in the gastric parietal cells. This leads to a decrease in gastric acid secretion, making it effective in treating conditions such as gastroesophageal reflux disease, or GERD, peptic ulcers, and Zollinger-Ellison syndrome. Correct me if I'm wrong. Now, for our indications, omeprazole is a proton pump inhibitor, or PPI, that is commonly used for the treatment of various gastrointestinal conditions. Its primary indications include gastroesophageal reflux disease, which is GERD. Omeprazole is often described to manage symptoms and promote healing of erosive esophagitis caused by GERD. It helps reduce the production of stomach acid, thereby alleviating symptoms such as heartburn and acid regurgitation. Next would be peptic ulcers. Omeprazole is used in the treatment of peptic ulcers, including gastric ulcers and duodenal ulcers. It aids in the healing of ulcerated areas by decreasing gastric acid secretion. Third one will be the Zollinger-Ellison syndrome. This is a rare condition characterized by tumors in the pancreas or duodenum that cause excessive production of gastric acid. Omeprazole may be prescribed in such cases to reduce acid secretion. Fourth one would be erosive esophagitis. Omeprazole is effective in the healing of erosions and ulcers in the esophagus associated with conditions like GERD. Then the fifth one would be Helicobacter pylori eradication. Omeprazole is sometimes used in combination with antibiotics to help eradicate Helicobacter pylori bacteria, which is implicated in the development of peptic ulcers. Gosh, I'm having tongue twisters in this. It's important to note that the use of omeprazole should be based on healthcare professionals' recommendation, and the medication should be taken as prescribed. Self-medication or prolonged use without medical supervision is not advised, as it may lead to potential side effects and complications. Now, for our contraindications, omeprazole has certain contraindications, meaning there are situations or conditions in which its use is not recommended. Contraindications for omeprazole may include: number one would be hypersensitivity. Individuals who have a known hypersensitivity or allergic reaction to omeprazole or any other components of the formulation should avoid its use. Then next would be concomitant use with atazanavir and nelfinavir. I have no idea what those medications are, but they're in the presentation. Omeprazole can reduce the absorption of the antiretroviral drugs atazanavir and nelfinavir, potentially rendering them less effective. Therefore, co-administration of omeprazole with these medications is generally not recommended. Number 3 would be severe liver impairment. Omeprazole is metabolized in the liver, and individuals with severe liver impairment may experience a shower elimination of the drugs. In such cases, omeprazole use may lead to higher drug levels in the body, and caution is advised. Number 4 would be pregnancy and breastfeeding. Although omeprazole is generally considered safe during pregnancy and breastfeeding, it's essential to consult with a healthcare professional before using it in these situations. The potential benefits and risks should be carefully assessed. And number 5 would be children under 1 year of age. Omeprazole is not typically recommended for use in children under the age of 1, except under the guidance and supervision of a healthcare provider. It's important for individuals to inform their healthcare provider about their medical history, existing conditions, and any medications they are currently taking to ensure that omeprazole is safe and appropriate for them. Always follow the prescribed dosage and instructions provided by a healthcare professional. Of course, this is a medicine, it would have side effects. Omeprazole, like any medication, can cause side effects. It's important to note that not everyone will experience these side effects, and they can vary in intensity. Common and less serious side effects of omeprazole may include 1. Headache. Some individuals may experience headaches while taking omeprazole. Number 2 would be nausea and vomiting. Omeprazole can cause gastrointestinal symptoms such as nausea and, in rare case, vomiting. Number 3, abdominal pain. Some people may experience abdominal pain or discomfort. Number 4 would be flatulence or gas. Omeprazole may lead to an increase in gas production. Number 5 would be diarrhea and constipation. Changes in bowel habits, include diarrhea or constipation, can occur. Number 6 would be dizziness. Omeprazole may cause dizziness in some individuals. Joint pain or musculoskeletal pain can be a side effect. And lastly, back pain. Some individuals may experience back pain. These side effects, however, are generally mild and temporary. However, if any of these side effects persist or worsen, it's important to contact a healthcare professional. Then we would go to the interactions. Omeprazole can interact with other medications, potentially affecting their effectiveness or increasing the risk of side effects. It's important to know your healthcare provider about all the medication supplements and herbal products you are taking to ensure safe and effective treatment. Here are some notable drug interactions associated with omeprazole. Number 1 would be clopidogrel. Correct me if I'm wrong with the pronunciation. Omeprazole may reduce the antiplatelet effects of clopidogrel, a medication used to prevent blood clots. This interaction is a topic of ongoing research and controversy. It's advisable to consult with a healthcare professional regarding the potential risks and benefits of using omeprazole and clopidogrel together. Next would be atazanavir and milfanavir, or antiretroviral drugs. Omeprazole can reduce the absorption of the antiretroviral drugs, atazanavir and milfanavir, potentially decreasing their effectiveness. Consider alternative acid-reducing agents or adjust the timing of administration if co-administration is necessary. Then next would be warfarin and other vitamin K antagonists. Omeprazole may increase the risk of bleeding when used concomitantly with warfarin or other vitamin K antagonists. Monitoring of the international normalized ratio, or INR, is recommended and dosage adjustments may be necessary. Fourth one would be digoxin. Omeprazole can increase absorption of digoxin, leading to higher blood vessels. Monitoring of digoxin levels and adjustment of the digoxin dosage may be necessary. These are just examples though, and there may be other interactions. Always consult with your healthcare provider or pharmacist for personalized advice based on your specific medications and health conditions. Next would be the dosage and administration. The dosage and administration of omeprazole can vary depending on the specific condition being treated and individual patient factors. It's essential to follow the prescribed dosage and instructions provided by your healthcare provider. And the following are general guidelines for omeprazole dosing. However, individual recommendations may differ. Number 1 would be gastroesophageal reflux disease, or GERD, and erosive esophagitis. For adults, the typical dose is 20 mg once daily for 4 to 8 weeks. In cases of severe esophagitis, a higher dose of 40 mg once daily may be prescribed. For pediatric patients ages 1 to 16, dosage is weight-based, generally ranging from 5 mg to 20 mg once daily. The duration of treatment varies depending on the condition. Next would be peptic ulcers. Duodenal ulcers, the usual dose is 20 mg once daily for 4 weeks. And for gastric ulcers, the recommendation dose is 40 mg once daily for 4 to 8 weeks. Next would be the Helicobacter pylori eradication. Omeprazole is often used in combination with antibiotics for the eradication of H. pylori. The standard regimen may include omeprazole 20 mg twice daily, along with specific antibiotics for a prescribed duration. Next would be the Zollinger-Ellison syndrome. The initial dose is often 60 mg once daily, with adjustments based on individual patient response. Now, it's important to take omeprazole exactly as prescribed by your healthcare provider. If you miss a dose, take it as soon as you remember. However, if it's almost time for your next scheduled dose, skip the missed dose and continue with your regular dosing schedule. Avoid doubling up on doses to make up for a missed one. Then we would go for our nursing considerations or interventions. Nursing considerations and interventions for patients taking omeprazole involve a combination of assessing the patient's health status, educating the patient about the medication, monitoring the potential side effects, and collaborating with other healthcare professionals. Here are some nursing considerations and interventions related to omeprazole. First would be the assessment. Health history. Obtain a thorough health history, including information about gastrointestinal symptoms, previous use of acid-suppressing medications, and any allergies or sensitivities. Next would be the medication history. Review the patient's current medications, including over-the-counter drugs, herbal supplements, and vitamins to identify potential drug interactions. Number 2 would be the patient education. Dosage and administration. Clearly explain the prescribed dosage, timing of administration, and the importance of taking omeprazole as directed. Next would be the duration of treatment. Inform the patient about the expected duration of treatment and the importance of completing the full course of medication. Then also avoiding certain substances. Advise the patient to avoid alcohol, tobacco, and certain foods that may exacerbate gastrointestinal symptoms. Number 3 would be monitoring. Symptom assessment. Monitoring the patient for changes in gastrointestinal symptoms such as heartburn, regurgitation, and abdominal pain. Next would be the signs of adverse effects. Watch for signs of potential side effects, including headache, dizziness, and gastrointestinal disturbances. Then, next would be patient safety. Risk of dizziness. Caution the patient about the potential for dizziness, especially when initiating treatment. Advise them to avoid activities that require alertness until they know how omeprazole affects them. Number 6 would be nutritional considerations. Calcium absorption. Inform the patient that long-term use of proton pump inhibitors like omeprazole may be associated with a slight increased risk of bone fractures. Encourage a diet rich in calcium and vitamin D, and consider supplementation if necessary. Number 7 would be potential drug interactions. Clopidogrel interaction. If the patient is taking clopidogrel, discuss the potential interaction with omeprazole and consult with the healthcare provider regarding the best course of action. Number 8, follow-up and referral. Regular follow-up. Schedule regular follow-up appointments to assess the patient's response to treatment and monitor for any adverse effects. Then referral. If necessary, collaborate with the healthcare team to refer the patient for additional evaluation or consultation. We would always tailor nursing interventions to the individual patient's needs and provide thorough education to enhance patient understanding and compliance with the prescribed treatment plan. Regular communication with the healthcare team is crucial for comprehensive patient care. Now we would analyze and present current research and evidence-based practice guidelines related to the specific drugs, which is omeprazole. Now, for the first one would be we would find it in the National Library of Medicine, National Center for Biotechnology Information. It would be entitled Omeprazole, and the other one would be Pharmacological Effects and Toxicogenetic Impact of Omeprazole, Genomic Instability in Cancer. The second one would be found on Curious, part of Springer Nature Group. It would be entitled Effectiveness of Omeprazole in Acid Peptic Disease, a real-world patient-reported outcome measures study. And finally, the third one, Frontiers in Genetics, entitled Omeprazole Treatment Failure in Gastroesophageal Reflux Disease and Genetic Variation of the CYP2C locus. Now, thank you for watching and listening. Have a good day and God bless. Once again, I'm Donna Alexina Rallos from BSN to Dushwan, and I hope you all enjoyed today's video. Bye! Entitled Effectiveness the pharmacological effects and toxicogenetic impacts of omeprazole. Okay. And the next one would be pharmacological effects and toxicogenetic I hope that's saved. Okay. These are just examples though, and they may be previous ones of Omeprazole can reduce the absorption of the antiretroviral drugs Omeprazole is Omeprazole can reduce the absorption of the Now for the contraindications. Omeprazole has certain contraindications which okay. This is a rare condition characterized okay. Self-medication is prolonged use without medical supervision is not advised, as it again. This is gonna be a video check. See if the noise outside can be detected. Okay, so that's about it. Yeah. There's a lot more noise coming. So. Good morning, everyone. My name is Donna Alexina Rallos, and today we will be